There was a surgeon in Harlem who noticed that when he was seeing women who had breast cancer, that he was seeing them very late stage, stage 3 and mostly stage 4, at a point where he really no longer could do anything to help them, or at least he felt that he couldn't help them. So Dr. Harold Friedman came up with something called navigation, so that there was a way to remove the barriers that these women were presented with when they were trying to get health care. So that's our job. So it's sort of twofold. One is that we try to decrease the time from an abnormal test until we can find out what it is and get them into treatment. But the other piece of that is, how do we find out what the barriers that patient is experiencing to getting health care, and how do we get rid of them? When you get diagnosed with cancer, typically no one, neither yourself nor the family, hears anything after the word cancer. So there usually is a sort of a time elapse while you're trying to figure out, what does that really mean? How do I come to terms with that? And then, what the devil did she say after they said cancer, and what do we do next? And so our job is to be an advocate for that family while they're going through what is arguably one of the most difficult times you're going to have as a patient in the healthcare system. So again, part of what we do is help them get to a diagnosis as quickly as possible. Once we have the diagnosis, we do everything we can to explain it in a culturally and religious, more religious sensitive way, so that they can understand it. They understand what their options are, and that way they can understand how to make a good decision for themselves. Because everybody has a different, reaction to cancer, and depending on when we find it, sometimes the answer is, I don't want to do anything, and that's fine, as long as they understand what they're turning down. So if it's an informed decision, that's what all we want, is that the patient and the family are making the best possible decision based on where they are and where they're coming from. So that may be full court press, where we do full chemo, full radiation, gamma knife treatment, where we do all these amazing things, or it may be a very beautiful and spiritual time with the family, where they talk about what their last wishes are, and then have those carried out. So that our job is to help maintain that journey as quietly and as beautifully as possibly can. One of the other things that we do as part of the navigation program is called diagnostic navigation. So as the patient is referred to the cancer center, again, that's a very stressful time for the family. And you're wondering, did they get the referral or what? So within 24 hours, or working days, 24-hour working day. So if we get it on late Friday afternoon, we may not call the family until Monday morning. But within 24 hours, we will call the family and let them know we got the referral. Get some other information from them, so that when they come in, that's less questions they have to deal with when they get here to the cancer center. We get an updated medical reconciliation form, so that we understand what all their latest medications are, so we make sure we don't give anything that's going to countermand what they're already taking. And then we just let the patient know right up from the get-go, this is what we think is going on so far. Do you have any questions for us before you get here? So that if we can answer the question, we do. If we can't, then we make sure that we notate that, so that when they meet with the oncologist, that they can get those questions answered. It's sort of on a continuum with navigation at one end, where we help navigate families through the beginning of a diagnosis. Transition can help families when they're being transitioned from the hospital to the home. And then palliative care is within that same spectrum, so that we can really inform the family about what's going on with their diagnosis, and then make realistic plans for what's going to happen next based on understanding where they are in the continuum of their own disease. Because everyone's familiar with mammography, everyone's familiar with pap smears and colonoscopy, although not comfortable, but colonoscopy as ways to search for cancer and see if we can eradicate it at an earlier stage. There is something, we've never really had anything for lung cancer. So chest x-rays, by the time that the cancer is visible on a chest x-ray, it's usually much later staged. So Medicaid and Medicare centers have recently approved something called a low-dose CT scan, and that has shown really remarkable improvements for catching lung cancers in a much earlier stage. Folks that would qualify for the lung cancer screening program would be anyone aged 50 to 75 who has a 30-pack year smoking history. And that can mean, because that gets confusing, so that can mean that you smoke 3 packs a day for 10 years, or you smoke 2 packs a day for 15 years, or 1 pack a day for 30 years. The other folks that would also qualify for the program would be if you are ages 50 to 75 and have a 20-pack year history of smoking, and you have something else going on like emphysema, asthma, hypertension, or diabetes. The cost of it is $75. And we're hoping that sometime in the future that other insurance companies will cover it and they don't need to make an appointment. They can just come in, and it takes about, depending on if there's anyone in front of you, but it takes about 5 minutes to actually complete the test. We also are offering tobacco cessation classes. They're for the patients, but also for family members, for anyone that works at Southeastern, and really it's open to anyone in the public. We tailor a program specifically for each person, and we have also set up technological advances to help with them as well, and that's with their smartphone. So there are tobacco apps now that help you with a daily reminder, or you can, if you need it really bad, you can actually click on the app and it actually sends you things quicker if you need it then. Then there's also a spiritual piece to it as well. So there is a monthly calendar of prevention activities associated with a particular cancer. In May, it's a Skin Cancer Prevention Month, so we are going to be actually out at the Relay for Life, which is an American Cancer Society program that raises money for cancer research. But we also, during that time, also want to have someone out there who can do screening exams on folks. We have a head and neck cancer screening day with one of our local dentists that's coming up. Colon cancer prevention month is March, and so every March we try to have some sort of outreach program. The most exciting thing that we are coming up with is the Bark for Life. As part of our Relay for Life efforts, we are going to have a 1 mile fun walk with your dog. They will be on leash at all time. And as long as we make sure that their immunizations are up to date, then all the proceeds from that will go to the local Relay for Life that occurs in May this year.